to Tuesday Tips. I am Dr. Vidal, and this is our weekly check-in. We discuss different topics in plastic surgery, and I get to answer your questions. Thank you so much for joining every week, for looking at the videos at the YouTube channel, and for sending me your questions. We will get to them. So today we're going to be talking about a topic that we talk during other talks, but we haven't done a live dedicated to it. So we're going to talk about thigh lifts. So thigh lifts is a surgery that a lot of people kind of want, but a lot of people are scared of. So we're going to go into the details of the scar position, why are different scar patterns, what other procedures we can combine with, and the post-op recovery and the possible complications, which is the area where most people are scared of. So we'll go into it and then we'll get to answer your questions, okay? So hope you guys like my little diagram here. I'm not a painter, but something that resembles a belly and legs, okay? And this is the knees here, okay? So the thigh lift basically addresses the inner thigh. When we're doing a circumferential body lift, that's when the actual anterior, lateral, and some of the posterolateral, so basically from here to the sides, that's where a body lift really addresses. A body lift doesn't really address the inner thigh because we have the groin in the middle. So if we want to address the inner thigh, then a thigh lift is the procedure of choice, okay? The scar patterns, it's really mainly two scar patterns that we can see, okay? The crescent thigh lift, which is basically the scar hidden in the groin, it does go anteriorly to about here. If you have a circumferential body lift, which I recommend doing first, okay? If you are a massive weight loss patient, you have a lot of excess skin in the lower body area, it's better to do the circumferential body lift to get rid of the belly skin, but also address the lateral thighs and the buttock area. Once all of that is repositioned, then we can address the thighs, okay? So the order, always first the body lift, then the thigh lift. So if you do have a tummy tuck incision, more or less there, then the thigh lift incision may connect to kind of assess or improve the mid anterior thigh. But usually if you don't, that's fine. We just hide it where the crease ends there in the groin, and posteriorly it goes not to the mid, but most like just a little bit of the inner buttock crease, okay? How much is depends on how much skin laxity you have, but usually it's hidden in the inner part, okay? Just in the inner part of your leg. The crescent thigh lift is good for people with excess skin in the upper inner thigh. It does not address excess skin down here close to the knee, okay? It's similar to a brachioplasty, right? Like if you have excess skin towards the elbow, you'll need the extended or the long longitudinal scar. It's similar in the leg. If you have a fold of skin going down to the knee, that's not gonna be able to be pulled up just in the inner thigh, okay? So that's when you get the regular thigh lift incision. A regular thigh lift incision, when you're looking at the inner thigh, like if you rotate your leg and you look like this, then it's like a T, okay? This is in the groin area and this goes in the inner thigh. So basically in the inner thigh towards your knee, which you can resemble here, and in the posterior view, just right in the middle. So if you're standing with your legs close together, you're not gonna be able to see the scar. If you rotate your leg, that's when you can see it in the inner thigh. Again, I try as much as possible to offer the crescent shape, and there are a lot of people that are in between that do have some laxity, but the majority of the laxity improves just with the crescent. As long as you understand that you will still have some amount of skin laxity in the knee and you're okay with it, then we can go ahead just with the crescent, okay? So that's basically the incision patterns that we can do. Plus minus liposuction. Why I put that? Because the majority of times when you have that skin elasticity, you also have excess fat. So what I do to improve the contouring of the inner thigh, I kind of do liposuction to all of that area and then just remove that excess skin to avoid much tension when you close it and also to achieve a better contour. Can we achieve a thigh gap in every single patient? Depends on your BMI, and really, if you have Latina thick thighs, sometimes your muscles are thick. So depends on a lot of things, but the majority of patients after a thigh lift do have a thigh gap in between, okay? So liposuction depends, but majority of patients benefit from it. If you're massive weight loss patients and it's just excess skin, then you don't really need the liposuction. When do I tell you? Basically in pre-op, when I examine you, we go over what do you need. If you need the liposuction, I will do it at the time of the thigh lift and basically kind of tighten everything up. What are the most important things about this incision, and why a lot of patients are scared of that incision? It's because it may migrate down. What do I mean by that? So if we're just doing the crescent, right? We're not doing this one here. The benefit of it is that we can hide it on a bikini, right? But what does it mean that it migrates? With time, gravity, and tension, this scar then ends up down here. So when you put your bathing suit, you can see the scar below the line of the bathing suit. Okay, how do I prevent this from happening? I put stitches on the fascia and bone, basically anchoring down the scar up towards your pelvic bones. Okay, it is a little uncomfortable in the first few days, but this is basically how we avoid that scar migrating, because it's not only closing the skin, it's supporting the deep tissues to the bone, so that way the scar doesn't migrate down. What is the other concern when we are talking about a crescent thigh lift? It's called labial spreading. It's basically, it pulls out your labia and they look kind of pulled out. How do you prevent this? Same anchoring stitches. If we anchor, then the tension is not in your labia. The tension is deep down in your bone. So when you're walking and gravity takes a toll, it's not pulling on your labia, so labial spreading doesn't happen. It pulls in the bone inside and it's correctly anchored, okay? So that's one of the things that you should ask your surgeon, is how does he or she reposition that to avoid scar migration and labial spreading, which the way I do it is anchoring down to the bone and to the deep fascia, okay? Massages and compression is the most, in every surgery is important, but in this surgery is very, very, very important. Why? When we tighten all of the inner thigh, all the lymphatic drainage and the venous drainage of the leg tends to go to the groin, okay? So when we tighten this area, you're gonna get very swollen from the thigh down. So the entire leg gets swollen, okay? So the compression initially is from your toe up to your waist, basically. So the entire leg. And your massages are gonna be from the toe up to your inguinal nodes, which are gonna need to rebuild those lymphatic channels to drain all that excess fluid that accumulates after the surgery. That is why I put drains in my thigh lifts, okay? You're gonna have one drain on each side to help redistribute all this lymphatic drainage that comes in the leg. How long would this drain be kept? Basically 2 to 3 weeks. It depends on everyone. Depends on how much is draining, but more or less 2 to 3 weeks, okay? How long do you keep the toe to hip compression? That is basically the first 1 to 2 weeks, basically while the drains are in. Afterwards, it depends on everyone. So if for patients that have leg swelling before the thigh lift, either lymphatic or lymphedema, or venous insufficiency, then this may worsen after surgery. So if you are a patient that gets leg swelling before you get the thigh lift, be prepared that this may worsen, and be prepared for them to need compression garments. I wear my compression garments every day. So my compression socks, that's my daily. So if you are a patient with compression, with chronic venous insufficiency or lymphedema, you should get comfortable with your compression socks because this is going to help you, not because of the surgery, just because of your venous condition and your lymphatic drainage condition, okay? So it's important to, I always ask my patients, do you have leg swelling problems before? Because that may worsen afterwards, okay? And let's talk about the complications. I mentioned the possibility of worsening the lymphedema and chronic venous insufficiency. And the other most important one is wound healing problems, okay? We are suturing in an area that's moist, that's sweaty, that's near our genitals, so it's not very clean. So the risk of having wound healing problems is higher. The other thing is with the arms, with the breasts, I'm going to ask you not to use your upper extremities a lot. I'm going to ask you to sleep a little bit elevated. With the groin, I want you up and walking. I don't want a blood clot after surgery, right? So I want you up and walking, so there's going to be some tension initially after the surgery. So what are the things that I'm going to ask you to do, especially the first 2 weeks, to avoid tension? I want you up and walking, but try to avoid spreading your legs apart too much, okay? What do I mean by that? So when you're walking, take small steps. So the friction or the movement in your legs is not that much. And when you're getting from in and out of bed, avoid spreading your legs open to get out of the bed. So probably the first week you'll need help for this. Someone that holds your arms and both of your legs turn at the same time. So when you are getting out and in from bed, your legs are together, okay? All of these things are gonna help you avoid tension. And the other one, it's a boppy pillow, the ones that we know mothers use for breastfeeding, use it for the necks. That boppy pillow can help you protect this incision when you're sitting down. So it's okay to sit, but that pillow is going to kind of create like a donut around this area that you don't have any tension there, and that's going to prevent, when you're sitting down, pressure on the ischium or your pelvic bone, which puts tension on the closure, okay? How long is the healing or the recovery? Really, the first 2 weeks are the ones that are more involved, that are you going to have or need more assistance, like I mentioned, getting in and out of bed, moving around the house. After the first 2 to 3 weeks, majority of patients are basically back to normal with restrictions of no heavy lifting or exercising for 6 weeks and no submerging in water for 6 weeks. The compression depends on, the length of the compression depends on the swelling at 2 to 3 weeks post-op. If at that point you're not having any swelling in your ankles, then the compression can be knee to waist, okay? To compress to the knee area. But if you have lymphedema or chronic insufficiency, then you may need ankle to waist compression for 6 weeks, okay? I'll take some questions now.
Okay. If you get a 360, do you still need a thigh lift if there is too much loose skin?
Yeah, very good question. But basically, the circumferential or 360 body lift will address the lateral, partially the anterior and posterior lateral, not the medial thigh. Thigh lift really addresses the medial thigh. Because of the groin and the buttock area, the inner thigh does not change a lot with the circumferential body lift.
Okay. Do you do abdominal sculpting?
I do. So abdominal sculpting or etching or high definition liposuction, it can be done with a tummy tuck. I am a little bit more conservative with the tummy tucks due to risk of skin necrosis when we're doing liposuction and thinning that abdominal flap. But definitely with liposuction and if you had tummy tuck, then with a 360 afterwards, we can do high definition. Most important thing with high definition to really see a result is your skin elasticity. Your skin quality needs to be good, that it attaches down to your muscles and you can see the definition afterwards. Awesome. Okay, that's it. Okay, thank you so much, you guys. Thank you for joining. I hope this answers the majority of the questions about thigh lifts. Remember, and especially for massive weight loss patients that need a lot of those patients need more than one procedure, I usually recommend to do a thigh lift alone. A thigh lift has the highest rate of wound healing problems because of what I explained in the groin area. So it's better to do it alone so you can focus on the recovery of this surgery, that it's a little bit harder than the other surgeries, okay? Do the body lift first, this one last. And also there are some non-scar alternatives like BodyTite, liposuction with Vaser or BodyTite to provide skin tightening for moderate to mild skin elasticity, okay? So if you have any questions, please drop them below. I'll be seeing you guys next Tuesday on Tuesday Tips. Thank you for joining. Have a beautiful week.